Hello there, it's Gina. Wanted to take a moment and make this video. It's been a good while since the last video that I posted, and I kind of wanted to talk about what's been taking up my time and really share my testimony, which is on passing my NCLEX-RN exam. I took the exam back in June. I believe it was June 17th, if I'm not mistaken. Um, so I went and I took the exam. I took my exam early in the morning. I think it was like 5:30 the test was scheduled for. So I was up way before the sun and drove like, I think it was less than 40 minutes to where the exam was, to the testing center. And it was an amazing experience. I passed, thank God. I'm super excited, and actually a lot has happened since I passed my exam. So this is my testimony on how I passed the NCLEX exam. So nursing school in itself is pretty difficult, and that in itself is a testimony for me. Like, just to anyone who's maybe thinking of enrolling in nursing school or going back to school, like in general, for whatever, and you may feel like with your work schedule, like, how is it going to work? Will you be able to find that work school balance, that work school life balance and all that? It's possible. What I can tell you is that what God has for you is for you, like, regardless. In the position that I was with, where I was working before, I was working for a health insurance company, and I was an operational trainer for the health insurance company. So my schedule was a pretty standard schedule of Monday through Friday from 8 a.m. to 4:30 p.m. Okay, and if anyone knows about nursing school, those hours are normally the hours where you have to either go to class or you have to go to clinical. Now, with my nursing program, I had already had my LPN license. So I did an LPN to RN transitional program, and I was able to do it online. So it was a little bit more freeing in the sense that I didn't have to go like strictly, on a daily basis for theory or for lecture. However, clinical, you basically have to get your clinical hours in when they tell you you can get your clinical hours in, at least for the program that I was in Miami. So when it came to some of the clinical schedules, and even like towards the end when we were getting ready to take our exit exam, and then when they were kind of like already preparing us for the board exam, you had to be there during the week. Like, one example, for my psych rotation, it was basically 2 days out of the week. I want to say it was Tuesday, Wednesday, and it was a 7 a.m. to 7 p.m. 12-hour shift for clinicals. Mind you, I was working the 8 to 4:30 Monday through Friday. So I can say it's only by the grace of God. Thank God for my manager that he placed in my path, who accommodated my school schedule. And mind you, I was a trainer, meaning if the trainer's not there, it's a bit much, because your responsibility is to train incoming employees on, what their job function is going to be. So it wasn't like, you know what I mean, it was just like, oh yeah, you're not going to be there, no big deal. You know what I mean? But at the same time, by the grace of God, it worked out where my manager was super supportive. And his thing to me was always, let's think about how we can do this. Do you have a plan in place? Let's see how we can be creative. He was just amazing. And I know for sure that that is God. That is God, when ways are made, like paths are open for you that you didn't even know how you were going to do it, but God does it. That's like amazing to me. Like, he took control, and it was like boom. I was able to, like, throughout my whole year of this transitional program, my manager was outstanding, and I was able to get that balance between work and school and able to complete it. So nursing school in itself is a bit much, to say the least. it does require, the discipline and all that. That's not anything that you want to do. School in general nowadays is not easy. So you really just have to have like a real commitment level to it. Now, on this NCLEX exam, most people ask, well, how did you pass your NCLEX exam? People go online and seek this information, like what did people do? How did you pass the exam? What book did you use? All this stuff. What I can really share with you from my experience is I have really 3 tips on passing your NCLEX exam. First and foremost, pray. Pray to God, okay? You need that prayer. You need the prayer to get through nursing school. And then on top of it, you need the prayer to make sure that you've learned everything that you needed to learn in nursing school to pass the state board exam. So when I say pray, I mean before you even pick up whatever miraculous study book you have to study from, pray to God, seek God that he may open up your understanding, that the material may not be foreign to you, because really and truly there are some things that you'll see in your review book that you did not necessarily delve into when you were in nursing school. No, they tell you they cannot possibly teach you every single thing about nursing. Some things you will learn from your review. Some things you won't learn until you start working as a nurse. So you pray to God that even those foreign topics, that you'll be able to grasp them, that they'll make sense to you, and he will give you his power from on high, that when you're studying this material and you're doing those practice questions day and night, that you will be able to comprehend what it is that you're doing. Pray that his will is fulfilled in your life. I got to a point where my prayer was, Lord, if it's your will that I be a nurse, that I may pass this exam. And my whole thing was too, you have to thank God in whatever place you're at as far as becoming a nurse, and thank him for what he's brought you through. Because I was also to the point, I was like, Lord, you wouldn't have brought me all the way through nursing school if it wasn't your will for me to be a nurse. So you, at the same time, you have to kind of claim his promise. You have to believe that he has not gotten you this far for nothing. Okay, he who starts a good work in you, he will fulfill it. Okay, like you have to trust in God. That starts with prayer. Really, really important. Now, second, after you've prayed for the wisdom of God and you've prayed for him to get you through those long nights of studying and to just keep your mind right and keep you mentally alert and focused, the next step definitely is to study. Don't think that, okay, well, yeah, I got through nursing school, but let me just go take this test real quick. I would definitely recommend that you take some time and study. Now, however long that takes for you, it's completely up to you. That's really an individual thing. I have heard that a lot of people say it is best that you not wait too long before you go ahead and take the exam, just because like when all the information is kind of fresh in your mind, it's better to not wait too long to take the exam. I can't really say that I follow that advice, not when I was studying for my LPN board, nor when I was studying for my RN board. With my LPN board, I was just so nervous that I just wanted to take as much time as possible. I want to say I took like a good 6 months to take my exam after I had passed LPN school. With this RN exam, it was a little bit different because right after I graduated, so I graduated in December, and like a few days after I graduated, I actually had to travel for work. So that's another testimony in itself, because notice how I didn't really have to do extensive traveling for work until after I had graduated. That's God. So after I graduated, I had to go on a work assignment for almost 2 weeks to New Mexico. And during that time, yeah, I bought the book with me and I studied sometimes, but it wasn't like, you know what I mean? I was in a new place. I was there for work. I was focused on doing well in the assignment. I really can't say that I dedicated a full amount of time to studying. When I came back, I then shortly after had another work assignment, which wasn't so far. I was in Orlando for like 4 weeks. But again, that was kind of like, I felt like I was not able to devote like the full time to studying for the exam. So I did wait until I felt like I was at a comfortable place, till I felt like I had really gone through the book and, felt, like in a good place, because your mindset is also really important when you're about to take the test. You want to at least feel like, yes, I did what I could to prepare, and I'm going in, strong on this exam. So to the studying, what I used to study for my exam was the Saunders NCLEX, what is it? Comprehensive Review for the NCLEX examination. This is the 6th edition. So this is what I use. I went with Saunders because I used the Saunders book when I was studying for my LPN exam. And being that I passed that, on my first attempt, I was like, if it's not broke, I'm not going to break it. So I went and I used Saunders again. I would highly recommend Saunders. I mean, I've used it twice. I do feel like the information was easy to understand. The language that the book is written in is not like, super complicated. The questions make sense. There are an abundance of questions in the book, and then also with that CD that comes along with it. I would definitely recommend that CD to do questions online. Really, some people say that you should focus more on doing questions than like the whole reading, and it got to a certain point where I definitely understood where they were coming from, because there were a few chapters, I honestly can't remember which ones, that towards the end I had not read the full chapters, but I switched to question mode and I was just doing questions on top of questions on top of questions. I think my goal was like 100 to 150 per day. I may not always have met that goal, but I strived for it. And honestly, any questions that you can do, they will help you. I downloaded a question app on my phone that was free. Did some questions on that. Honestly, just get in the question mode, because the whole rationale behind doing all the questions is to get yourself in a mode where you're thinking critically to see what the correct answer is, because you know that more than one of the questions or more than one of the answers to the questions is going to look like the right one. So you need to be able to decipher, okay, this makes more sense than that one, so let me go with that one. That's the whole thing of doing questions, to kind of like get your mind in that, no, y'all are trying to trick me with this mode so that you can, do well on this exam. My exam was 75 questions, and then the computer stopped. I kind of knew for some reason that the computer was going to stop at 75. Maybe from my LPN exam experience too, because I had gotten I had gotten 75 questions on the LPN exam. So for some reason in my mind, I just knew it was going to stop at the 75 questions, and it did. To the point, like when I got to question 75, I was already backing up off the computer, because I was like, yeah, that's it. Okay. Not to say that I went with the whole, yeah, if you get 75 questions and it shuts off, then you pass, because I've heard that that's not always the case. That you can't have 75 questions and fail. If you haven't taken the exam yet, we are not claiming that. That is not for you. I am not speaking that into your life. I do hope that you pass the exam, because I know what it is to go through nursing school. And if you work through nursing school, I know the struggle, because I did work the full time. If you're not working, it's still a struggle, because it's hard. I really do wish you all the best on this exam, and I do hope that you pass. Like, honestly, if you need any kind of support, if you just need somebody to chat with real quick, send a quick email, get some words of encouragement, vent, please don't hesitate, because us nurses, we're all in this together. It takes a village. What else can I say? Of course, I can't divulge any information about the exam. That's a no-no. The format of the questions in the Saunders book, as far as, a mix of multiple choice, a mix of select all that apply, fill in the blank, all the pharmacology questions, all that stuff, I would say that it's pretty true to the exam. And again, just from doing so many questions before you take the exam, the format of the question, yes, is going to make a difference, but a question is a question is a question. Just think about it this way. They're trying to get you to think as a nurse, to prioritize as a nurse. So a lot of times in those questions, it's not about, okay, what is the right answer? Those prioritization questions are going to be, okay, you're the patient's nurse. You walk into the patient's room. This is a situation. What do you know as a nurse that you need to do first for that patient? You just have to get in that mode where you're looking for the answer that makes sense from a nursing perspective. Like, that's the only way that I can sum it into words. You just have to think like a nurse. At this point, you're about to take the exam. You graduated from nursing school. You are a nurse. You may not be a registered nurse yet, but you're a graduate nurse, right? So you have that level of cognitive ability to think as a nurse would think. So use that, like, don't second guess yourself, the whole staying on a question for like 10 minutes. No, you get that question, you read it. What makes sense from a nursing perspective, choose that and you move on. Do not get caught up in the question that gives you that drug name that you have never heard of. If all else fails, take an educated guess and you keep it moving, because you can't stay like on one question forever. You just have to keep going, and trust me, you will get to the end of the exam. God willing, you will pass the exam, and you won't even remember the question anymore, because you'll be like so in a state of relief and nervousness and all that stuff. Speaking of relief and nervousness and all that stuff, so of course you don't get the results right away when you pass the NCLEX exam. From my understanding, it's a minimum of 2 days. Yeah, it was like 2 days to get like those official, unofficial, because we look at that as the official score, but then it tells you that it's an unofficial score like after the 2 days when you log in. Either way, I'm pretty sure if you haven't heard about the Pearson trick, you probably will after you take the test, because you're gonna start to Google. I did do the Pearson trick, and it was my first time doing it. I don't believe that I did it after I took the LPN state board, but I did the Pearson trick. And when I did it, it had changed recently. I didn't know. So when it took me to that credit card page, I was like, oh, man down. But it actually did work, because I did it like that first day, and then I did wait the 24 hours, because they say you're supposed to wait the 24 hours. And it still did give me that pop-up that I wasn't able to go ahead and pay a second time for the exam. You'll get that error message that says that the records show that you've taken it or something like that. So that did bring me a lot of relief. However, I did not speak to anyone about whether I had passed or failed until after those 2 days, when I saw that my license was posted on the state of Florida license verification website page. So I did not share it with anyone, the whole Pearson trick thing, because my whole thing was I need to see the license online before I start telling people that I'm a registered nurse. But yeah, what else can I say about the experience? It was a great experience. So step 3 now. So we said pray, right, for understanding when you're studying for the test. Study study so that you can pass the exam, right? The Bible says study to show yourself approved. I feel like that proves true with taking the NCLEX also, because you need to know what you need to know to pass the test. Thirdly, believe, right? After all that studying that you did, all that praying that you've done, believe that you will pass the exam, because your mindset is really, really important. If you go into the test that day feeling like, man, I'm about to fail this test, it's not a good thing, right? You have to go into there with a victorious mindset. You have to just be like, okay, I did everything that I could, right? Hand it to God to do the rest. You have to believe that your prayers have been heard and answered, and that you were led to study exactly what you needed to study. That's another thing that I prayed for. I was like, God, you already know what's going to be on this exam. help me to study exactly what it is that I need to study, right? Like, just, you have to kind of just meditate on good thoughts, start to see yourself in that position. Don't dwell on negative thoughts. Don't, because it's just going to put you in a bad mindset when you go to take the exam, and you definitely don't want to be in a bad mindset. Yeah, so that's really what I would say. Pray, study, and believe. And I wish you great success on your NCLEX RN exam, or if you're taking the NCLEX-LPN exam, congratulations on that. And, I hope you do well on that also. As I said, I did do the LPN program first. And this is a testimony also, because when I did my LPN, I never worked as an LPN, because after passing my exam, I couldn't get hired as or I did not get hired as an LPN, because the places that I applied for, they were just like, well, you have to have this much of experience. My whole thing is, how am I supposed to get the experience? You won't hire me. So it was very, very difficult. And I didn't let it stop me though, because I was like, well, you know what? Maybe this LPN is not meant to be. Let me keep striving. So I did go back to school, got the RN, and an amazing testimony with that is that I took the test, I believe it was June 17th. By less than 2 weeks or 2 weeks later, I basically had already secured a position. After I took the exam, I started applying online like crazy. I do not over exaggerate. I must have applied for like 20 to 25 jobs, maybe even more. I applied to jobs locally to Miami. I applied to jobs as far as like within 4 hours away. And I got a call very quickly within a week or two, maybe a week and a half. I drove out to the job, which is where I'm currently living now. I live closer to the Tampa area, which is like 3.5 hours from Miami, which is home for me. And I went, did the interview, got the call the next day, was offered the position, and I started this position. It was August 3rd. So it's been a little over a month. It's been amazing. I thank God. I'm very, very grateful, because to go through years of having an LPN license and not working on it, because I had that license since 2011, right? So I thank God, because I know what it is to finish school and not get a job, right? And this has turned out to be the complete opposite experience with my RN. So if you are someone who maybe you have your LPN and you're going for this RN in hopes that it'll open more doors for you, I definitely believe that it will, because that's been my experience, and I do hope that it's your experience as well. Don't be discouraged. Like, apply. I would definitely recommend to you, like, if you feel, or if you found in your area where you live that it's not as feasible to find a job right away in that area, don't limit yourself. I mean, of course, I don't know what your circumstances are, but if you do have the opportunity to move to another place for a position, and God has given you the means to do so, go for it. You know what I mean? Because ultimately that experience will definitely help you. And then if you decide, later on to go back to where you came from, you'll have that experience. You know what I mean? It's really important to just get your foot in the door, like get in somewhere, right? I've heard hospital experience is great. That's where I am now. I work in a hospital setting. I would definitely just recommend that you keep your options open, right? Be open to whatever God has for you. Receive, you know what I mean? Receive that, what He has, even though it's not necessarily what you envision. You know what I mean? Just try and get your foot in there, right? What else can I say? I think that's it. I just really wanted to come on and share that. It's pretty late since I passed and I've been working, but I just wanted to get on and give some encouragement that if you are preparing for your NCLEX exam, you can do it. I'm rooting for you. It may be difficult, but nothing is impossible with God. Nothing is impossible if you trust Him, if you do your part, right? Pray to Him and trust Him. Do your part by studying, and then believe that you have what it takes to pass the exam. You will pass the exam. Please share your success stories, comment, feel free to share your experience, what has helped you. Remember, we're all in this nursing thing together, right? We love up on our patients, so we should be able to love up on each other and encourage each other, in those times of getting through school and getting through exams and all that stuff. So hopefully I'll be able to share more of my nursing experience on here with you guys. Thank you so much for watching and have a great day. Bye-bye.